बहुत सी फीमेल्स हमारे पास आती हैं और बोलती हैं हमारी ब्रेस्ट में एसिमेट्री है, वन साइड इज बिग, वन साइड इज स्मॉल, वन साइड इज नॉर्मल, वन साइड इज सैगिंग, and permutation combination of these, and I want to correct them. So we'll discuss about how to correct them. Now one has to understand all women's breasts, both sides are not totally same. I always tell them to all my patients that both side breasts you may be having like they are like sisters but not twins. तो similar होती हैं but बिल्कुल same नहीं होती. So 19-20 का फर्क सब में होता है. अगर आपको लगता है कि वो 19-20 से ज्यादा का फर्क है, then a surgical procedure can be done for you. So what are your options? First of all, you have to decide whether you want to increase the smaller size or reduce the bigger size. Okay? You can also choose to do both. Increase the size of small one a bit and reduce the size of a bigger one a bit so that they meet in the midline. You can also choose to increase the size of both to achieve the symmetry. So you have three options: reduction of the size of one side or both sides. You can choose to do either one of those, or you can choose to decide increase of size of one side or both sides. So you should have clarity of what you want. At the same time, if you have sagging on one side or both sides of the breast, that also needs to be lifted. So when you do a breast lift surgery, we do a procedure which is called a mastopexy and lift the whole breast up. So if one side is sagging, you will definitely need a lift there. You cannot achieve symmetry without lifting the sagging breast. Okay? If both sides are sagging, you need a lift. Again, along with lift, depending upon the size you desire, whether you want enhancement, you want reduction, you should have clarity of thought. Now, of course, whenever we are doing a lift or a reduction, you will have a lollipop scar. That is a circle around the areola and a vertical scar, which is on the under surface of the breast, so it's less visible. If you are going for enhancement or augmentation, there are two options. If you are doing with fat, just needle pricks, no big cut. But if you are going with implants, you will have one inframammary incision, that is beneath the breast. We make a small incision so that we can put in an implant inside. This incision will be between 2.5 to 4.5 centimeter, depending upon the size of implant which you decide to undergo for. So, depending upon whether you want enhancement, we can do enhancement by fat grafting or implant. If you want reduction, we can do reduction as well as lift at the same time. If you want to do reduction, lift, plus at the same time you want an implant to give you a higher footprint of the breast with a bigger size of implant, but a bigger size of breast, but a nicer upper pole fullness and cleavage, like an implant look, we can do two options. One is auto-augmentation reduction technique, in which we have also published a paper in which we use your own breast tissue to enhance the shape of the breast. Or you can go for implant. So these are different permutation or combinations which we can achieve. I understand this can be confusing for you, but don't get confused. First of all, have clarity of thought. You want increase in size or reduction in size, whether you want a lift, whether you want increase in sizes of both or reduction in sizes of both to achieve the symmetry. Once you are clear with what you desire regarding the size and the shape, discuss with your surgeon. Each and everything is possible, but you should have clarity of what you want. If you have any more questions about this surgery or any other cosmetic plastic surgery, please connect with us. Me and my team are always there to guide you honestly and scientifically. Thank you.